X-ray guidance and go into the kidney from above, right through the skin, through certain pathways that we know, through certain areas that we know are the least risky, and again under X-ray guidance, to put a catheter in to drain the urine out, and then sometimes to break up or remove the stone. Yeah. And so that would be one example.
Yeah, I just read somewhere about them, I think it was a kidney, removing a kidney. I don't know whether this was through radiology or interventional radiology or not, but where the doctor cut it into small pieces so he could remove it without major surgery.
Right.
This does happen.
That does happen, and that was probably a laparoscopic removal of a kidney. That was probably not done by an interventional radiologist, probably by a surgeon using minimally invasive surgical techniques, which are a little bit different.
Yeah, I was going to say, explain laparoscopic surgery versus interventional radiology, because it seems like the same thing to me.
Okay. Well, one big difference is you can think of laparoscopic surgery or arthroscopic surgery done for lots of different joints as using a very small camera on a tube, generally significantly larger than most of the catheters that we use. But with that kind of camera, a small incision is made to go into a joint or to go through the back to the area of the kidney. And that camera directly visualizes the area right where the surgeon is going to work. And sometimes they will introduce a few other instruments that way through small tubes, but still generally bigger than our catheters. So that's arthroscopic or laparoscopic, and they're looking on a camera. So the source of what they're looking at is coming right through the tube.
Right.
And what we do, we're using X-ray, CAT scan, or the guidance system or the imaging is from the outside, and our pathways that we're working through are usually even smaller, the tubes and catheters. So we're watching, using just a different imaging outside the patient that can be positioned in lots of ways to get to our target, as opposed to bringing the camera directly into the area of the body.
I understand the difference now.
Okay.
One's got a camera on the inside and you're looking from the outside.
Exactly.
Yeah. So what procedures are you doing mainly here at Berger?
We're doing a variety of procedures, very straightforward and simple, but important ones such as biopsies, draining fluid from around the lungs or the abdomen when people have various kinds of infections or inflammation disorders. One of the big procedures is vertebroplasty and the pain injections such as epidural steroid injections, which we talked about, facet joint blocks, and selective nerve root blocks for all sorts of pinched nerves and issues with the spine that cause pain in the back and in the arms and legs. We see quite a few patients with peripheral vascular disease, blocked arteries, the same kind of cholesterol blockages that block the heart arteries, or the carotid arteries can block arteries to the legs and cause pain walking, or cause problems with kidney function or high blood pressure when they block the arteries to the kidneys. So we see those patients and we'll perform angiograms through the small catheters where we inject dye and diagnose the exact problem, and then use balloon catheters, angioplasty, or sometimes metal stents, as are used in the heart, to open up these blockages. With an aside to that, it's probably worth mentioning that angioplasty and stent placements were first performed by interventional radiologists.
Okay, because that's become very popular.
It is, and it's was developed by interventional radiologists in the 60s and 70s especially. But it is shared, it's a technique that's grown, and it is shared by a number of specialties now, as it's grown in its uses. So especially for cardiologists in the heart, it is very, very important and effective. Other procedures we do are uterine fibroid embolization at Berger, and dialysis access, or that's an area we didn't really talk about, but patients who are on dialysis and need special catheters to allow their blood to be cleared, we place those catheters and deal with those catheters to help keep them getting their dialysis in an effective way. and also for the shunts that are put in the arms, those sometimes close down, and we can unblock them or keep them functioning to allow them to be treated. So we're doing all those things at Berger,
Yeah.
just as for a few. The list goes on too.
Sure. So with the women's with the fibroids, you're doing your job versus having a total hysterectomy.
Yes.
Really it simplifies things.
It does. And there are some other options too. And that's one of the great things that interventional radiology offers, and that I think the patients are just starting, and the public is just starting to understand more, is the options we provide, the non-surgical options. And that's one of the big things that we talk about with them in our consultations. We don't just tell them about the one thing that we do. We want to make sure that they know also if the surgical option might be better. We want them to know that. If there's a medical therapy and they don't have to have anything invasive done, it's important that we let them know about that too. And of course, we're working with their primary care physicians or the referring physicians to help to decide what's the best situation or what's the best treatment given their situation.
Yeah, you brought up referral physicians or whatever.
Yes.
People don't come to you directly. They are referred by their family physician. Is that right?
Most of the time they are referred by their physician, by their surgeon, whoever it may be, by another specialist. But some patients are coming to us directly, and they find out about us from our website. They might read about some of these new techniques, and increasingly we're trying to educate the public and also educate other physicians too about some of these new treatments. So patients can come to us directly. They probably might want to check with their insurance first to see if we're in.
That's always important. Does insurance take care of this procedure?
Yes, yeah, insurance, the vast majority of what we do, of the procedures we do, are covered by insurance. So people shouldn't necessarily be thinking first that, oh, this won't be covered.
Right.
And I wouldn't want them to miss out on something that might be a very good treatment option for them for that reason.
It's not experimental necessarily.
No. And they'll have procedure codes and diagnostic codes that go with them, and so insurance does cover the vast majority of what we do.
Yep.
So people shouldn't be as concerned about that as they might be.
That's always a concern.
It absolutely
for any
is,
patient.
Especially
one more time, office location at Berger?
Our office location is second floor of the Berger Medical Office Building. And the number to reach us again through your physician, or you can call us directly if you have a question or think you might need a consultation, is 740-420-8181.
Yeah, I think most importantly, talk with your family physician.
Absolutely,
yeah.
And we'll be happy to talk to them too.
You mentioned a website.
Yes, the website to find out actually about a lot of these procedures is sirweb.com. Again, sirweb.com with the www right before that. And you'll find out a lot about every procedure I think I've mentioned here today, plus others that we offer. But the best way we don't make appointments with our office over the internet at this point. Definitely the best thing to do is to call us.
Shoot. Yeah, give them a call. Dr. Eric Dolen, interventional radiologist at Berger Health Systems, and of course affiliated with Riverside Radiology Associates. So thanks again for being with us and sharing with the community here on Berger Beat.
Absolutely.
Thank you, Dr. Dolen.
Thank you.
And for CGTV5, this is John. I'll see you next month on Berger Beat.